Hello and welcome again. Thank you for tuning into this episode. I created this episode to help you understand the intersection between grieving the loss of a loved one versus having a depressive disorder. This topic confuses a lot of people and, well, it is a little complicated. So my hope is that I can sort it out for you in a way that will help you understand it better. The most common depressive disorder that the average person talks about is what mental health professionals call major depressive disorder. And the rest of our society commonly refers to this disorder as clinical depression. So that's the term I will use in this video for simplicity's sake. Most of us from time to time in our normal lives will experience periods when we are feeling sad, perhaps sluggish, and or just plain down. Those feelings may last for a few hours or even days, and we may or may not be able to pinpoint the reason we're feeling that way. But we are usually able to continue to cope with life in general. Can you relate to feeling down or depressed for a limited period of time? I'll bet you can. Most of us can. Clinical depression refers to a person being impaired by depressive symptoms for at least weeks, if not months. A clinically depressed person finds it very hard to just get by. They struggle with multiple telltale symptoms that allow a health professional to diagnose them with a depressive disorder. I will share those symptoms with you in a moment. First, I want to make this point. The telltale symptoms of clinical depression are so similar to typical symptoms of a grieving person that mental health professionals could be fooled if they didn't already know that their patient is grieving the loss of a loved one. Typical symptoms that may be experienced by both grieving people and clinically depressed people include the following. First, a depressed mood most of the time on most days. A loss of interest in activities which previously you enjoyed. Now, you may experience disordered eating, which would be too much or too little, disordered sleep, which would be too much or too little, an unusual amount of fatigue, feelings of hopelessness, worthlessness, or guilt. You may have a decreased ability to concentrate. You might even have thoughts about dying and suicide. Do some of those symptoms sound familiar? If you are struggling with several or even all of these symptoms as you mourn the loss of your loved one, that would be normal and natural. Unpleasant, but normal and natural. But hold on there, Ron, you might be thinking right now, that description sounds a lot like me. Are you sure I don't have clinical depression? And my answer, without being able to carefully interview and assess you, is this. You probably should not be diagnosed with a depressive disorder, at least at this time. Why? Because these symptoms, when they're attributable to a loss, mean that you're grieving, and grief is not pathological. In fact, grief is a natural and normal response to the loss of a close loved one. Grief is justifiable. It's a justifiable reason for these symptoms. Therefore, formal diagnosis of a mental disorder, even though the symptoms are very similar, should not apply. And I suppose that's my primary message to you. You don't likely have a depressive disorder. Rather, you are reacting as a normal human being, otherwise in good mental health, with significant symptoms, which may last for a while, by the way, and they certainly can be impairing. But they are temporary and they are attributable to the grief that naturally follows the loss of a loved one. A few more points need to be said, however. First, if you were diagnosed with major depressive disorder before the loss you are presently grieving, your condition should be reviewed by your physician and or your mental health care provider. Getting a professional opinion is never a bad idea, so why not do it? Your physician might suggest some medication to assist you. If you're already on medication, he or she might adjust the dosage for you for a little while anyway, to help. And or if you were working with a therapist for your depression before, might it not make sense to at least check in with your therapist? Second, if you are struggling with thoughts around suicide at this time, you should definitely get assessed by a physician and right away. Such thoughts are not unusual around the time of loss, and talking them through with a professional is just plain smart. So please make an appointment today if that's the case for you. See, studies show that there's a concerning correlation between major depressive disorder, what we're calling clinical depression in this episode, and suicide. And many people grieving the death of a loved one admit that they have thoughts of not wanting to live. I know that was true of me. At one point, I would have told you, you know what, when I go to bed tonight and go to sleep, and if I didn't wake up, that would have just been fine with me. Such thoughts are even more common if the manner of your loved one's death was suicide. Anyway, please do a thoughtful self-assessment right now. Just take a minute or so. Are you presently struggling with self-destructive thoughts? Thinking of actually killing yourself, maybe? Can you say to yourself with certainty at this moment that there is no current risk of you planning and carrying out a suicidal attempt? If you cannot confidently say that, you are potentially at risk of harming yourself. You don't even need then to finish the last couple of minutes of this video. Turn your efforts now to being assessed by a competent professional, which could be a primary care physician, a mental health professional, going to an urgent care center, or an emergency room. On the other hand, if you are confident that you are okay and contemplating suicide is not on your radar, then let's go ahead and wrap up this episode. Whichever one it is, go ahead. Please consider these key take-home points. First, depressive disorders and grieving have very similar symptoms. If you've not previously been diagnosed with clinical depression, your symptoms are most likely due to your natural response to loss. If you are currently distressed about your grief symptoms, or if you have been previously diagnosed with clinical depression, I want you to see a physician or mental health provider very soon. If you're currently contemplating suicide, stop everything and see a physician or go to a local emergency room right away, okay? I want to leave you with a stepping stone. Take a brief inventory of your emotional and mental well-being by reviewing the symptoms listed above. Those are the ones I talked about. If you relate to 5 or more, consider getting a professional consult by a physician or a mental health care professional. And please reflect on this. This is a saying that I found. There are wounds that never show up on the body. They are deeper and more hurtful than anything that bleeds. I give credit to Laurel K. Hamilton for that. Well, I thank you for being here today. I hope this episode was of some help to you. At least maybe cleared up some questions that you had about depression. And I look forward to speaking with you soon on similar topics. In the meantime, please be well.